So there's a number of reasons why women have low libido. So maybe you started your antidepressant during that time, or maybe you went through menopause during that time. Or if
Mm-hmm.
you're a person that, as I mentioned, that might have had breast cancer or some of these other things, did they start hormones during that time? Was it a
Mm-hmm.
tragic event that happened in your life during that time? So
Mm-hmm.
we go through a bunch of elements in their history.
Hi, welcome to another episode of Let's Talk About This. I am your host, Crystal Hicks. My guest today is Dr. Gittens. Dr. Paul Gittens is one of the leading sexual medicine physicians in the country. He's an expert in the treatment of sexual health for men and women and a specialist in male and female menopause and male infertility. Welcome to the podcast. Dr. Gittens, how are you today?
I'm doing great. Thanks for having me, Crystal.
Thanks for coming on. I'm glad we're talking about this because, with a lot of medications that people take, including myself, these medications can have side effects when it comes down to, your body and things of that nature. Like for me, I noticed that when taking a antidepressant, it kind of lowered my libido a little bit
Mhm.
to where I didn't have any interest in sex anymore. So, give me a little information about how those medications could affect your overall sexual interests.
Yeah, so it's good you brought that up because there's a number of things that can affect sexual interest, and
Mm-hmm.
medications is one of them. SSRIs, which is selective serotonin reuptake inhibitors, are big ones, and so your your audience may know these as like Paxil or Zoloft. These are medications that help with depression. They can increase mood and everything, but they definitely, for the most part, for most patients, they can lower libido. You know,
Mm-hmm.
and it's an effect that is kind of full circle, right? So you're having some depression, and then your libido is low, and because your libido is low, you have some decreased mood. you know
Right.
and
Right.
so it's definitely one of the things that we see. It's one of the more common reasons why men and women have lower libido and sex drive. So it's a big thing. There's a number of other things. There's other medications that can cause that, cause some issues. For women, I see a lot of women that have breast cancer, and are on medications that lower their hormones, so that can also cause some issues. Men that maybe have been on anabolic steroids and they come off the steroids, they can have some lower libido. So there's a number of medications that can cause this.
Now, how could that be reversed? Is there a way where you can come back and to your for your body to have that natural feeling as before? Oh, how could you reverse that?
Yeah, so one of the things is trying to either lower the medication. That's one thing that we try. Another thing is to switch you to a different class of medication. So there's a number of other types of antidepressives that we can, with the guidance of a psychologist or psychiatrist or your primary care doctor, can try to switch you over to that will
Mhm.
have less side effects. So there's definitely some help out there. If there are some patients that can't come off of their medications, then
Mhm.
we'll try to treat above it. So we'll try to do some other things while they're still on the medications to increase their libido.
Okay, so what other things what do you do? What kind of treatments do you do to increase it?
So it depends on the reason, right? So there's a number of reasons why women or men have low libido. Some of them is, as I mentioned, it could be hormones, right? So if they're a candidate for hormones, then we'll prescribe hormones, and they could be bioidentical hormones or non-bioidentical hormones. That's one of the things.
Mhm.
One thing is we like to increase dopamine. So there's some medications that can increase dopamine, which is kind of this high, it's more of a pleasurable hormone, right? And
Mhm.
so by increasing dopamine, it can help. We know that exercise helps with libido as well, because it does increase dopamine and some other of the natural hormones that increase libido. There's some medications that are on the market that work on a whole different system outside of dopamine. It's a different system with epinephrine and serotonin and all these other things that can help with libido as well. So it
Mhm.
really depends on the reason why the
Mhm.
libido is dropped.
Mhm.
Sometimes it's going on a vacation and really getting away from the stressors of life,
Mhm.
or just throwing your spouse away and say, listen, I'm not talking to you anymore. You're causing me to have a low libido. So as you can see, it just really depends on the person. And that's part of my job is trying to figure it out because it's not a cookie cutter menu or ingredient. It's not a cookie cutter thing for everyone.
Mhm.
It's really being able to kind of sit down, talk to that person. Sometimes we'll order hormones. We talk about their life experiences and everything, and then we go from there.
Mhm. So how like for men, do men have these type of problems as well?
Yeah, yeah. Men and women. We see both men and women that have problems with libido, problems
Uh-huh.
with most when you think of men, everybody talks about erectile dysfunction, so we treat that. But guys
Mhm.
have other sexual problems. They have lower libido. They can have problems with ejaculating too quickly or not ejaculating at all. Some guys
Mhm.
have problems with decreased sensitivity of their penis. Some guys have pain with ejaculation. It ranges, and in my practice we see women with not just low libido, we see women that have pain with intercourse, that have no orgasm, or maybe it takes them a long time to have an orgasm, pain with
Mhm.
sex, so we see the gambit of things in our practice. And like I said, we tailor our treatment specifically for that person.
For each particular person.
Yeah.
So for instance, if I had to come in there and I had to come see you and I say, Dr. Gittens, okay, my libido is low. I'm not really having interest in sex. Where would you start with me as a
Well,
patient?
yeah, I would first question would be how long has this been going on? Like, and then and I would try to say, all right, let's look at a number of factors which maybe occurred during that time. So maybe you started your antidepressant during that time, or maybe you went through menopause during that time. Or if
Mm-hmm.
you're a person that, as I mentioned, that might have had breast cancer or some of these other things, did they start hormones during that time? Was it a
Mm-hmm.
tragic event that happened in your life during that time? So
Mm-hmm.
we go through a bunch of elements in their history, and then what we'll do is we'll get some blood work. So you'll go to your nearest lab, and we'll order a bunch of blood work. We'll look at all your hormones because one of the more common reasons is menopause. So where are you? Maybe you're still getting your period, but maybe you're perimenopausal, or maybe you had your uterus removed and you're not really sure if you're in menopause or if you're not because you're not getting your period because you haven't had it for years.
Mm-hmm.
So
Yeah.
we check your right. So we'll check your hormones, and then we do a physical exam as well. So if you're having pain with intercourse or something like that, we check like the pH of the vagina. We
Mm-hmm.
do a specialized kind of a sexual medicine physical exam where we're looking for certain components in the exam to maybe try to figure out why you're coming in that time.
Hmm. That's interesting. So so you're saying that like well in my case for instance, I haven't had a period in years. It's been about what, 6, 7 years.
Mm-hmm.
And on top of that, I've been taking an antidepressant
Mm-hmm.
for a while because I was having struggles with depression.
Mm-hmm.
Um, so I believe that kind of numbed me a little bit, I guess.
Mm-hmm. The
Uh,
antidepressant.
yeah, I'm thinking it's more so like the antidepressant. And there are probably other women out here who are probably having the same, problem that I'm having. So it's good that you're here to explain, how you can get around that and going back to having that natural feeling again. So you're saying you would have to take the blood work first, and then you would go from
Yeah,
there to
yeah, but also like your history, you said you haven't had a period in a while. So, I mean, I don't know if you want to get into everything, but like, why haven't you had a period? Is it because you're in menopause, or because you had your uterus removed, or because you're on medications that that prevent you from getting your period. So we have to really get granular when we're
Mm-hmm.
talking about these things because
Right.
everybody's a little different,
That's true.
and so it's not so I always warn people that if somebody says like I have this solution and this solution works for everyone, then you should really run,
Mm-hmm.
because it's not when you treat as many people as I treat, you realize that, somebody can come in. It could be your twin sister, right? It could be
Right.
someone that looks exactly like you, same height, but the reasons for their sexual problem could be
Mm.
totally different,
Right.
And so, you really have to take every person as an individual and then go
Mm-hmm.
from there.
So if a woman had their uterus removed, that also affects that lowers your hormones once you have your. I mean, I've never had that done, but there are some women who had to have their uterus removed for
Well, yeah. So
specific reasons.
for specific reasons. So I was saying the
Yeah.
uterus thing because I was saying that for some women that aren't sure if they're in menopause, because there's some women that have the uterus removed before the age of 50. So say 50 is the average age in this country where most women go through menopause. But say you had to have your uterus removed at 40 or 35 for some reason. And so they wouldn't be getting their period during that time. So we don't really know when they're going through menopause. So that's one of the reasons. But
Mm.
to answer your question specifically, if you have your uterus moved only, then most women don't have symptoms. It's when you remove the ovaries.
Mm.
And ovaries are what produces the hormones. That being said, there are some women that have lower libido after just removing their uterus and keeping their ovaries in it. And I've seen
Mm.
it all. So it really depends. But in general, the thought is for that if you remove your uterus, then your sexual function should be the same, but that's not always the case.
So
The more you do, what's that?
how do you replace your hormones if you're if everything was removed? How do you replace the hormones? You use medic is that is some you is it an injection that you use or
You can use for hormones, you can use creams, you can use injections, you can use pills. There's so many different ways to replace hormones. You can use pellets. There's so many different ways that we use. And so it depends on preference. It depends on, I have some women that tell me that they don't want to place a cream on. So they may need oral medications. So, there's a lot of different ways to replace hormonal therapy. And same thing for men. So for men, if they're replacing their testosterone, right? It's injections. It could be creams. It could be pills. It's a
mhm.
number of ways to replace it.
Mm, mm. And that what now for men, when I know you mentioned that they have erectile problems when they don't have when their libido is low.
Well,
Uh
they can, or it can happen individually. It can happen separately, or it can happen with low libido.
oh really?
Hmm.
Okay, because that can affect your relationship too. If you ain't if that the man can't, do what he's supposed to do in the bedroom, that could be a problem.
Yeah, it's a problem a lot of the time. I see a lot of men that come in and their self-esteem is down, their confidence down.
Mm,
They don't want to, even come to be, have any kind of intimacy with their partner because of the fact they can't get an erection.
mm-hmm.
And it really brings them down. So, yeah, it's a big issue that we see, and we treat a lot of it. And there's like predictors that some guys that maybe are a little unhealthy, guys that have diabetes, men that
Mm-hmm.
have high blood pressure. These are some reasons why men will have erectile dysfunction.
Well,
And so we
mm-hmm.
try to get out in front of it.
Mm-hmm. Well, I noticed with men, a lot of men don't really like to go to the doctors. That's another thing I noticed. So they wouldn't even know if they had pre-existing conditions. Um, so I think that don't you think that would start there is if more men, especially black men, if they would go and see a doctor regularly, because as women we usually, most women, most of us, we usually make sure that we go to a doctor yearly. It's hard to get men to go to a doctor on a regular basis.
Yeah, I
You
mean, I
know?
think, yeah, you're totally right. I mean, I think for a number of reasons. I think that one of the reasons is that we're not really used to going to the doctor.
Mm-hmm.
For men, for most women, they start going to the doctor when they get their first period or close to the first period or what have you. And so they really start at a younger age,
Mm-hmm.
where most guys don't go to the doctor unless they have a problem or they need a high school physical for their athletics, you know.
Mm-hmm.
And so it's just not really ingrained in a lot of guys that that a doctor is someone that you go to for not just like a problem that's occurring, but for also preventative things. So I
Mm-hmm.
think that's part of it. Um, Another thing is when you look at who goes to the doctor and who is really in charge of healthcare and families, it's oftentimes the women.
Mm-hmm.
When they have a different sex couple, it's usually the women that's pushing the guys to say, "Hey, listen, like it's time to go to the doctor," because most guys either forget about it or they just don't want to deal with it.
Right.
Um, and so it is an issue because there's a number of things that affects you the for men as well as the black community that you mentioned. We have prostate cancer, we have colon cancer, we
Mm-hmm.
have diabetes, where we have a obesity problem, hypertension, high cholesterol, so many different things that affects men that we really need to get in front of, so we can prevent having some of these sexual dysfunction issues.
Mm-hmm.
So it's really important. So if he's exercising, if he's eating correctly, if he's avoiding diabetes and all these medical problems, then his erections are going to be stronger, you know,
Mm-hmm.
and then he won't have to see me until a little bit later in life, as
Mm-hmm.
opposed to a little bit earlier. So if you want to
Right.
stay away from me, you got to start doing the things that are healthy and good for you.
Okay, so what are all the things like you said? You said you have to exercise. What else you should do? Eat right, I guess.
Yeah, you want to make sure you're eating right. You want to make sure if you have diabetes or any of these hypertension that you're controlling it, you're not
Mm-hmm.
ignoring it, you know.
Right.
Um, you want to make sure that, there are some guys that have low testosterone and all these other things. So, if you're experiencing ED, then you may want to get some hormones checked. So we check your thyroid, your testosterone, we check a bunch of hormones to make sure that's not one of the causes.
Mm-hmm.
Um, so those are like the big things. I mean, other things that lead to ED outside of, hypertension, high cholesterol, there's some nerve issues that can be a problem. Some guys have some scarring of their penis that can lead to like a curvature of their penis.
Mm-hmm.
Some guys have some psychological issues. We call it adrenaline mediated erectile dysfunction, where because they've had so many bad experiences in the past, it's hard to get an erection when they're with a partner.
Mm-hmm.
So there's a number of things that we look for to see if we can try to either abate the symptoms, or we can treat the symptoms, or we can
Mm-hmm.
prevent the symptoms. One
Right.
of the things that we try to do to prevent the symptoms is guys, when they stop having those morning erections, that's kind of the first sign that they're going to start having some erection problems.
Mm.
So at that point, I like using like penile pumps. We use something called the exerciser, which is a
Mm-hmm.
penile pump
Mm-hmm.
that helps to kind of increase the circulation to the penis. It helps to kind of just get guys kind of moving in the direction of prevention and treatment. So
Mm-hmm.
so I like that. We
How
also
do you use that? It's a pump. You put the pump on
yeah.
the
So
penis, and what do you do?
So the exerciser is a hydro pump. It's a hydro pump, and
Mm-hmm.
it's one of the pumps I use. I do talk for the exerciser company, but we use it anyway, so it works. So a pump is it's a pump. It's a negative uh, pressure device. So essentially, you fill the pump with water.
Mm-hmm.
You can use it in the shower, okay? And when you're using it in the shower, there's a negative pressure that's exerted in the pump, and it helps to kind of increase the blood flow to your penis. So you're getting kind of a semi-erection in the shower. And
Mm.
what that's doing is getting extra blood flow into the penis, and so it's just helping with the circulation of the penis. So we have guys to do that for preventative reasons, as well
Mm-hmm.
as guys that have ED. It's part of our kind of system and getting guys back to having more natural erections.
What is ED?
Oh, erectile
Yeah.
dysfunction. I'm
Oh,
sorry.
erectile. Okay. All
Yeah, I'm
right.
sorry. So
Oh.
erectile dysfunction or I like to call it erectile difficulties. I don't like to
Oh,
call it.
okay. Okay. Yeah, this is interesting. You know, especially for people who are dealing with a lot of these sexual issues. Now, does age have how long do men stay erected? Is there an age limit to where they can actually get it up? Because I know when you get a certain age, sometimes some men can no longer,
Yeah, so age so the answer is that the older you are, the more likely you are to have erection
Mm-hmm.
problems.
Mm-hmm.
But that being said, there's guys that come into my office for other reasons that are in their 70s and
My
80s and they're
eyelash, my
still and
eyelash went up for a minute. I'm sorry.
um there's guys in their 70s, 80s, they're still getting good erections. So it's not
At
there's
70 or 80?
yeah, at 70 is still getting good erections. So it's not something that but those guys when you look at those guys and
Uh-huh.
you look at their look at their medications are minimal, right?
Uh-huh.
These are guys that have
I'm about
probably
to
you all
take
right? Yeah,
I'm taking these eyelashes
take them
off.
out, take them out.
I'm taking them off. I was trying to be cute, but anyway, I just
You still look just fine over there. Don't
uh,
worry about it.
thank you.
Um, so there's guys that are in their 70s, 80s, but if you look at those guys over time, those are the guys that are usually healthier, right?
Okay.
Those are guys that probably exercised a lot, minimal health problems. Those are guys that are maintaining their erection throughout life.
Mm-hmm.
So it's something that all the guys should be striving for, is being
Mm-hmm.
able to have an erection at 80 or 90 years old. Why not? You know,
Mm-hmm. Yeah, yeah, because you can still, as a woman, you would want your man to perform as long as he can,
that's right. That's right.
So that's the thing, So, but yeah, this is interesting to talk about because, a lot of women are dealing with having low libido issues and things like that because, us women, we go through a lot, I mean, we go through like we was just talking about earlier, sometimes you have to have your uterus removed because of medical reasons and things of that nature, and sometimes you might have to be on certain medications, and then it can put you in a depressed mood too, because if you're not interested in having sex, that's a normal thing that we should have, it's a normal emotion that that's a part of being in a relationship, and when those things are missing, it could kind of do things to you psychologically too,
Hmm.
so but what are some of the advice that you can give to some women out there who are going through these different type of issues?
Yeah, I would say
Yes.
that that there's more than just one of you out there. There's so many women that are going through these problems.
Mhm.
And so the good thing about that is that there is help out there, right? If you're the only person, there's not going to be a lot of help for you. But
Mhm.
the fact that there's thousands and probably millions of people in the United States that have this issue and throughout the world, that
Mhm.
there's definitely help. So it's not something that you should give up on. It's
Mhm.
just something that you just have to find the right person,
Mhm.
or to find the right physician that's going to be able to treat you. So that's like
Mhm.
the main thing I would say.
Yeah,
Um,
because is a lot of this covered under your insurance? That's the thing. Or is this something that you have to pay out of pocket? Because that's another issue when it comes to medical situations, where people sometimes based on their income, they can't afford to go and have these things done if it's not covered under their insurance. How does that work? Is this
yeah.
something that have to be paid out of pocket, or is this something that could be covered under your insurance policy?
So I think it depends on who you go to.
if
to
it's in a
answer that
network?
question. If it's in their network, I mean, I don't take insurance. I'm on a network. We have like our level is much higher than what you're going to get at, your primary care doctor or your OBGYN.
Mm-hmm.
The level of care that we give, um, and the time that my patients spend with me. So, like for instance, if you come to see me, you're going to spend at least an hour or so in my office, right? Where we're
Mm-hmm.
going to be talking about all this. Where if you go to some other practices, it might be like 15 minutes or so. So you have
Mm-hmm.
to find, if you're fortunate enough to find somebody like on a high level that takes your insurance, I think that would be great.
Mm-hmm.
It's just, my practice, we just can't do that. Just
Okay.
because of the fact that we just spend so much time with our patients that
Right.
we just, unfortunately, I wish we could. I
Right.
wish there was more of, me to be able to do that, but we just unfortunately can't.
Yeah. Yeah. Another question I wanted to ask you. Some men they take what is that they take to get themselves hard? I can't even think of it off my.
Like Viagra or Cialis.
Yeah, Viagra. Is that safe for men to
Yeah,
take? Could that affect their their
yeah. So in general,
erection when
well,
when they take those those Viagra pills and things like that?
yeah. So Viagra and Cialis, that's what they're for. They're for a person that's having some erection problems.
Mhm.
And either the erection problem's not, it's not, maybe they're not starting properly or not able to maintain their erection, and
Mhm.
they take one of these medications about an hour or so before.
Mhm.
And it can really boost their erections. It can allow them to have sex, or it can allow them to maintain a little bit longer than they would if they didn't take the medication. So,
Mhm.
but in general, they're safe. I mean, with these medications, just like any other medication,
Mhm.
there could be some interactions with other medications. So you just have to be careful not to take those other meds,
Um,
especially like nitroglycerin and some of the heart medications. But other than that, they're very, very safe. And every medication has side effects. So sometimes guys may get like a little bit of pain in their legs or in their back, or they may get some heart palpitations. But in general, they're very, very safe, and their side effect profile
mm,
it's not so high. So.
mm. Yeah, well, for me, I know I really I hate taking pills to be I really do. And I would like to, is there alternative medications that you can take, like holistic, any things that are natural, rather than using prescription medications, because like you said, a lot of these medicines, these prescriptions have side effects.
Mhm.
And I know for me, I only take prescription medication because I have to. But I'm on my way to going into alternative medications where I could do things more natural. Is there alternatives in your practice that you offer outside of medication?
Yeah, so a lot of my patients, especially my guys, they're like,
Mm-hmm.
Doc, I don't want to take any like Viagra or Cialis for my erections. But like I'm gonna go to the gas station and pick up something to help with my erections, right? And if you look at what you pick up sometimes from gas stations or herbal stores, right? A lot of it has that active ingredient that you would get in a more pure form in medication, right?
Mm-hmm.
So I get that all the time. Like, I'm not going to take it, I'm not going to take it, but you are taking it. You're taking it, and it's not regulated, so we don't even know what's in it, right?
Mm-hmm.
And it could be an amount that we don't suggest that you take that's in these medications that people are taking over the counter. All right. So
Mm-hmm.
we just have to really be careful about that, because a lot of people are taking those things anyway, right? You take an
Mm-hmm.
herb, like what's really in that herb, and is it being mixed with something else that you don't know about that's giving you a positive effect? So that's
Mm-hmm.
something that we have to really be careful about, because we can't measure the interaction between medications if you're taking something.
Mm-hmm.
Um, so in terms of things that we do naturally to help, so there are a number of things that I do in my practice that can help with, I'll start on the male side and then I'll go on the female side. So there's things that we can do to increase blood flow to the penis naturally, right? To
Mhm.
get guys erections, right? So there's a number of things that we use, some protocols that we use that can accomplish that. So guys can come off of their Viagra or Cialis so they don't have to take it.
Mm.
Um, Also for women, same thing. So for women that are having some issues with orgasm, in particular, we there's also some things that we can do, like a small little in-office procedure that you come in for, nothing painful or anything like that,
Mhm.
that can help with like orgasms,
Mhm.
right? For natural things for libido, we talked about a couple. We talked about exercise in particular, right? We talked
Mhm.
about removing all the things that could be causing you to have low libido, like those medications that you're on, and trying to find another medication to that's going to help to either increase your libido or at least get rid of the side effects from the medication you're on that cause the problem with libido. So those
Mhm.
are things. As I mentioned, exercise is big. Exercise is big for libido.
Mhm.
And then there's some men and women that have issues that kind of go beyond my practice, where they may have to talk to a therapist about things, right? And
Mhm.
so therapy can also help with low libido, especially if
Mhm.
you're having some issues, if there's stressors or what have you that are kind of filtering down into low libido, right? So you
Mhm.
should, that's something that we also can either recommend or help, men or women. We can guide them in the right direction.
Mhm. Yeah, therapy is a big thing, you know. There's so many people are dealing with, a lot of mental issues going on, So that can I know that the mind can affect the body as well.
Oh, they say, what do we say? We say the biggest sex organ is between your ears, right?
Yep.
That is the everybody thinks it's like the penis or the vagina. No, it's actually the brain, right?
Yeah.
And you have to be able to mentally stimulate yourself, or somebody can mentally stimulate you, which then starts this whole cascade of eventually getting down to the penis and the vagina, right?
Uh-huh.
So yeah, so I totally agree with you. Therapy can help.
Yeah, yeah. Yeah, that's a good thing to know. So, tell me a little bit about yourself. Which I should have probably asked you before we started the interview, but I wanted to get right into
You got right into it. That's all
get
right.
right into it.
That's all
But
right.
give the audience a little bit of a background about yourself.
Yeah, so
Uh,
I am a board certified urologist, like you mentioned. Have practices in Philadelphia, well, right outside Philadelphia, one of the suburbs. Um, in Allentown, which is in the Lehigh Valley, and then New York City.
mm-hmm,
And in my practices, as we kind of discussed, we treat men and women for all different sorts of sexual problems. Anything that happens in the bedroom, we treat it,
mm-hmm,
essentially. As well
mm-hmm,
as my other passion is male infertility. So I treat a lot of men that are having problems with having children.
mm-hmm,
And so we treat men for male infertility. We also do a lot of vasectomy reversals so for guys that have had a vasectomy and they want to, father a child for another reason. Maybe they
mm-hmm,
got remarried or maybe they changed their mind. We also do microsurgery for that. So
mm,
um, yeah, and so I mean, my practice, yeah, it's kind of my baby. I've been doing this for a long time,
mm-hmm.
and yeah, it's great. We also do girth enhancement. That's another thing that we do. So for men that want to increase the girth of their penis, so we also help them with that. So,
The girth of the penis. What's that?
well, the circumference of their penis for guys that want a bigger penis, not a longer penis, but a bigger penis,
Uh-huh.
we help them with that too. So we do a procedure to kind of help them with the girth.
Oh, okay. Oh.
So many, so
Oh.
so many, so I would just recommend anybody that's interested, just go to my website. You can find out about all this stuff. It's Rockwell
Right.
Centers, Centers with the S, rockwellcenters.com. You can find out about all the cool things that we do in the office.
And this is in New York? That particular office is in New York?
Yeah, we have
Okay.
offices, all three offices, New York, and then the two in Pennsylvania, one out right outside Philly and the other one up in the Lehigh Valley.
Now you said that you can for men who are, I ain't I'm not against people who are gay or whatever the case may be. So you said so for a man who wants to um have his you remove the penis if they decide they want to.
No, no, we don't do that.
You don't
No,
do
no.
that kind of stuff?
No,
Oh.
I don't do any transgender work. No, I
Oh,
was just saying
okay.
that we do girth enhancement, so we make it bigger.
Oh, okay. All
Yeah.
right.
Yeah, but
So,
I don't do any transgender work.
oh, okay. All right. So, yeah, so where can people find you on your website?
Yeah, so rockwellcenters.com and then Instagram at Dr. Gittens.
Okay. All right. Well, this was an interesting conversation. I hope the audience got a lot of information out of you for about the sexual, because, sexual intercourse is very important when it comes down to relationships, and sometimes we don't think about that. We don't think about the fact that how things can affect our bodies as well, when it comes down to like different medications and things like that that we take. We don't really think about how that can do a lot to our bodies, but I know for me personally, I'm in the process of trying to do some alternative kind of medication to reverse the libido, because I take a medication called venlafaxine. I don't know if you
Hmm.
heard venlafaxine. And then there's this little, what's the blue pill? I see you in your article, you had something about the blue pill that you was talking about. I thought I saw something in the article there
For women,
for women. I think it was for women.
yeah, so there's a number of there's other pills for women too that can help with libido. There's something on the market called Addy, which is a medication that we use for libido. That
Mm-hmm.
might be blue or that might be pink. I'm not sure.
Mm-hmm.
Um, sometimes we give Viagra off label for women as well to help with libido and orgasm and
They have
sexual pleasure.
Viagra for women.
Well, sometimes we use Viagra off label. We use it
Mm-hmm.
off label for women for certain situations as well. So I'm not
Oh,
sure which
wow.
article. Yeah, it's a lot of little things that we do, a lot of little tricks that we use to help out.
Oh, that's interesting. That's interesting. Well, Dr. Paul, thank you for coming on the platform and sharing all this good information. Any things you want to give out to the audience before we close out? Any more information you would like to share?
Well, Crystal, I got to tell you, it's the questions are great. I
Oh,
mean,
thank you.
these are real questions, and I hope your audience was able to, I feel like you're probably reading the minds of some of your audience members, and so hopefully they'll learn a lot from this.
Yeah.
I would just say that in general, as I mentioned before, that if you're having any kind of sexual problems, you don't have to do this alone. If you
Mm-hmm.
have a partner that's having sexual problems, they don't need to do it alone. You can find a specialist in your area that really focuses on this.
Mm-hmm.
And then you can get help, because like you mentioned, it really affects relationships. Like I have guys that, they sleep on the couch so they don't have to, go to bed at night to be intimate with their partners. And same thing with women,
Mm.
and so there is help out there, and there's hardly anything that we can't fix to some
Mm-hmm.
degree, or at least make better.
Right.
And
Yeah.
so I would just I would really just if you're having some problems, I would really go look for some assistance.
Yeah. Yeah. That's good to know. Um, and that it's kind of eye opener because sometimes a man won't even want to come out and even talk about these type of things with their
Yeah.
partner. They could be ashamed or embarrassed about it or feel like, so
Oh,
it's
yeah.
good to have these conversations, because like you said, this stuff can be fixed. You don't have to be in a relationship where you can't have the sexual intercourse as a part of being in a relationship.
Yeah, I would say about 20% of the guys, maybe 20%, 25% of the guys that come in,
Mm-hmm.
and I asked, because I asked everybody, how'd you hear about me or what have you? And they
Mhm.
said, "Oh yeah, my partner, they made the appointment for me." You
Oh,
know?
really?
Yeah, so it's one of those things where sometimes it's not, sometimes people need a little pushed. And they
Right.
always say,
Yeah.
I'm glad I'm here though, because like, if they didn't make it, then I probably wouldn't have made it. So,
Right.
so if you're
Yeah.
a partner of and your partner and your partner is having some issues, then try to find somebody for him. Maybe give him or her, like, say, hey, listen, like, I know you're having these issues and I'm here to support you. And I went on the internet and I found somebody, and
Mhm.
let's make an appointment. I'll go with you. Let's go together.
Right. Yeah. It's good to have that support. Yeah. Yep. Well, thanks again. I really appreciate you coming on and sharing this good information. Now that people know that they have these options, that they can use to get these things fixed, because like you said, everybody is different.
Mhm.
Everybody, every, things work different for everybody's body. So, but yeah, this is really interesting, and I appreciate you coming on. And I want to say to the audience, I hope you enjoyed this interview, and make sure you subscribe to the channel, so we could bring on more experts like Dr. Paul Gittens. And then until then, we'll see you then.